Hello, my dear friends, and now let's talk about the ulnar nerve. So, in the major nerves category, we have completed musculocutaneous nerve and axillary nerve. Now, let's move on to the most important ones, and that is your ulnar, median, and the radial nerve. Out of these three, first let us learn about the ulnar nerve here, guys. As I said you, whenever you learn about any nerve, first of all, write down the origin of the nerve here. And origin, I hope you all are perfect here. Ulnar nerve will be originating from the medial cord of brachial plexus. And what is the mnemonic? The mnemonic for the medial cord will be M4U. And here U stands for your ulnar nerve, guys. So ulnar nerve is originating from the medial cord of the brachial plexus. Then what is the root value of the ulnar nerve? I hope you remember it is having something exceptional there, guys. C7, C8 and T1. C7, C8 and T1. So normally all the branches which are coming from the medial cord, their root value will be C8 and T1 only. But ulnar nerve will be having like C7, C8 and T1, guys. Now after learning the origin and the root value, the next thing starts the most important thing, that is your supply. Ulnar nerve will be supplying to which muscles? And we are going to study this one by one, so step by step. First we'll see in the arm, then in the forearm, then in the hand. Now first in the arm. Recall in your mind, will ulnar nerve supply to any muscles in the arm? Absolutely no. Like, how can you say so confidently, guys? It is not supplying to any muscle in the arm. You can tell it like very confidently by using my golden rule. I said you that all the muscles in the anterior compartment of the arm, musculocutaneous nerve, and all the muscles in the posterior compartment of the arm, radial nerve. That means there is no question of ulnar nerve. Ulnar nerve is not supplying to any muscle in the arm. Then the next thing, the ulnar nerve will enter into the forearm. Okay, so in the arm, it is not supplying to any muscle cell. Then the next thing will be the forearm. Will ulnar nerve supply to any muscle in the forearm here, guys? Yes, of course. Which compartment? In the anterior compartment. So ulnar nerve will be supplying to the muscles in the anterior compartment. But will it supply to all the muscles in the anterior compartment? No. We have seen in our golden rule, all the muscles in the anterior compartment of the forearm will be supplied by two nerves. One is your ulnar nerve, another one is median nerve. So we need to learn here, out of all those flexor muscles present here, which muscles are supplied by ulnar nerve, guys. So first remember that ulnar nerve will be supplying to medial 1.5 muscles. Medial 1.5 muscle of the anterior compartment. Now what is it? One complete muscle? Yes, the medial most one, that is flexor carpi ulnaris muscle. Flexor carpi ulnaris muscle. And another one more muscle which is supplied by ulnar nerve will be FDP, guys. Flexor digitorum profundus. But as I said you 1.5, that means ulnar nerve is not supplying to the entire FDP. It will be just supplying to the medial half of the FDP. Medial half of the FDP. And of course, without any doubt, the lateral half will be taken care by median nerve. Okay, so let us just make a note of all these things. So in the forearm, ulnar nerve will be supplying to medial 1.5 muscles of anterior compartment. Okay, medial 1.5 muscles of anterior compartment. Now what will be this 1.5 muscle? Number one, that will be your flexor carpi ulnaris. Flexor carpi ulnaris muscle. And number two will be the flexor digitorum profundus. Flexor digitorum profundus muscle, guys. That's FDP. But remember, it is not supplying to the entire FDP. It is only supplying to the medial half of that one. Medial half of the FDP, guys. Then what about the lateral half of the FDP? Lateral half will be taken care by the median nerve. So again recall here, can I call this FDP as a composite muscle? Absolutely. Any muscle which is supplied by two nerves will be definitely a composite muscle. So better we'll do one thing here. We'll just add a note here itself, guys. So what about FDP? Flexor digitorum profundus muscle. We can divide that FDP into two halves. One will be the medial half and another one will be the lateral half. The medial half of the FDP will be taken care by ulnar nerve and the lateral half will be taken care by the median nerve. So therefore, FDP you can add to the list of composite muscles, guys, or hybrid muscle. So in this manner, what I will do is one by one, like whatever hybrid muscles we are going to come across in the entire anatomy, we'll just keep on making a list of this one here, sir. Fine. Now we are actually like continuing with our ulnar nerve. We are done with the arm. In arm, ulnar nerve is not supplying to any muscle, and in the forearm it will be supplying to medial 1.5 muscle. Comfortably done here. Now that ulnar nerve will be entering into the hand here, sir, and it will be supplying to certain muscles in the hand. Now guys, I hope now you will 110% agree with me. That's the reason why before itself I have actually completed all the muscles here. Now see here, no much stress here, no tension at all. Comfortably, very calmly, we are able to recall the names and we are able to write down here, sir. That's all. So similarly, try to recall from the muscles of hand. There are totally how many muscles, guys? 20 muscles. But all the 20 muscles are not supplied by ulnar nerve. Ulnar nerve will be actually supplying to 15 muscles out of that 20, like 15 muscles, sir. Let us try to, first of all, understand here. Later on, we'll make a note of that. So ulnar nerve will be coming from the medial side and it is going to pass like superficial to the flexor retinaculum. And then it will be supplying to all the hypothenar muscles, the digiti minimi one, hypothenar muscle. There are totally 4 of them. One is, the flexor digiti minimi, abductor digiti minimi, opponent's digiti minimi, and then you have got the palmaris brevis. So all those hypothenar muscle. And then that ulnar nerve will be also supplying to the 3rd and 4th lumbrical. The 3rd and 4th lumbrical. Out of totally 4 lumbricals are there. 1st, 2nd, 3rd and 4th. Only 2. The medial 2 will be supplied by ulnar nerve. Then it will be also taking care of all the interossei, the 4 palmar interossei and 4 dorsal interossei. And then it will be going on the other side. On the other side, one of the exception, I even said you that one also, that is adductor pollicis, guys. So on the other side, ulnar nerve will be supplying to one of the thenar, that is adductor pollicis, and it is going to go and end there. It is going to end in that one. That is the reason why it is said to be the graveyard of ulnar nerve. Understanding? So let me just summarize once more here, guys, and then we'll write down here. Come on, you also try to tell it by yourself wherever you are studying. Ulnar nerve will be entering here, supplying to all the hypothenar, then 3rd and 4th lumbrical here, and then all the interossei, 4 palmar, 4 dorsal interossei. Then on the other side, it will be supplying to one more muscle, that is adductor pollicis. Adductor pollicis, guys. So let us continue in the same sequence. Arm completed, forearm completed. Now let us see, ulnar nerve will be supplying to which muscles in the hand. So it will be supplying to all the hypothenar muscles. All the hypothenar muscles, guys. Okay. Then next, number 2, it will be supplying to L3 and L4. That is your 3rd and 4th lumbrical. And then it will be supplying to all the interossei, the 4 palmar and 4 dorsal interossei. And then it will be supplying to what, guys? The adductor pollicis. And as I said you, adductor pollicis is the last muscle to be supplied by ulnar nerve. That means ulnar nerve will go inside that and it will end there only. That is the reason why this adductor pollicis is said to be the graveyard. It is graveyard of your ulnar nerve. Graveyard of the ulnar nerve. Okay. Now, my dear friends, look there. Out of the 20 muscles of the hand, almost like 15 muscles of the hand will be supplied by ulnar nerve. That means ulnar nerve is the dominant nerve in the hand. It is a dominant nerve in the hand. And that is the one which is controlling like majority of the movements of the hand. That's the reason why all those movements are required for playing musical instruments and all. I hope you are able to recall. Ulnar nerve is also said to be the musician's nerve, guys. So that is the reason why ulnar nerve is said to be the musician's nerve. Done. So we have comfortably completed the entire motor supply in the arm, forearm and the hand. All the muscles has been done here. And now what we'll do is, after writing down all these things here, now we'll try to make a simple schematic diagram of the ulnar nerve so that you retain that more nicely. And along with that, we'll also see the applied aspect of that one, guys. If there is an injury like higher lesion and lower lesion of the ulnar nerve, how will you differentiate there? We'll see that. Okay, so do it in the same sequence. First, make a note of all the muscles. Once you get that very clearly in your mind, crystal clear, then try to make a schematic diagram so that you can retain it for a longer time, guys. Okay. Now just imagine here, this one is the lower end of the humerus, guys. The lower end of the humerus, it will be having that lateral epicondyle and there will be a medial epicondyle, a prominent medial epicondyle there. Now, ulnar nerve, it is not supplying to any muscles in the arm. Okay. What is going to happen, sir? The ulnar nerve will just pass here. It is not going to supply to any muscles in the arm. And then one more important point to make a note here, it is going to pass behind the medial epicondyle. Behind the medial epicondyle. So in this diagram also, I'll try to, incorporate more points here, sir. So that is the best way to learn. Step by step, slowly, you keep on adding the points and learn. Everything at once doesn't make any sense. Okay. So now, ulnar nerve is going to pass behind the medial epicondyle, and after that, that ulnar nerve will actually enter into the forearm. Now, how it is entering into the forearm here, guys? How is that ulnar nerve entering into the forearm? Now, it is going to enter into the forearm by passing between the two heads of flexor carpi ulnaris muscle here. So, there will be flexor carpi ulnaris muscle, there will be two heads of that. Between the two heads of that, it is going to pass and enter into the forearm, guys. So, it is going to pass between the two heads. I'm just writing here. Between the two heads of flexor carpi ulnaris. Now, you might be thinking like, why sir, stretching a lot here? Yes, there is a reason in this one. When it is passing between the two heads of flexor carpi ulnaris there, guys, there itself, yes, it is going to actually pass through a tunnel. And that tunnel is said to be the cubital tunnel. Be very, very careful with this one here. Don't get confused with the carpal tunnel here. It's cubital tunnel, cubital tunnel. So, ulnar nerve is going to pass between the two heads of the flexor carpi ulnaris through the cubital tunnel. That's the reason why whenever you come across a question, cubital tunnel syndrome, yes, what is the nerve involved there? It is the ulnar nerve which is involved there, guys, compressed there or trapped there. Understanding? Now, so basically, it's entering into the forearm, supplying 1.5 muscle, as I told you, flexor carpi ulnaris. And not only flexor carpi ulnaris, it is also supplying to one more muscle, that is FDP, flexor digitorum profundus. And we all know very well, it will be supplying only to the medial half of flexor digitorum profundus. Medial half of flexor digitorum profundus. Now, after that, arm and the forearm is done. Arm is done, the forearm is done. Now that ulnar nerve will actually enter into what? It will enter into our hand. And here also we have like something important to take a note about. There will be a flexor retinaculum here, guys. There will be a flexor retinaculum here. Okay. There will be a flexor retinaculum here. And you got to decide, okay, suppose if this is the flexor retinaculum, you got to decide whether the nerve is actually passing superficial to that or deep to that one, guys. And remember, ulnar nerve is the one which is going to pass superficial to the flexor retinaculum. It's going to pass superficial to flexor retinaculum. So, ulnar nerve will pass superficial to flexor retinaculum and enter into the hand. Now, after entering into the hand, it is dividing into two branches. One is the superficial branch and another one will be the deep branch, and that deep branch will take a turn and go on the other side, guys. So, in the hand, it will be actually dividing into two branches here. One will be the superficial branch and another one will be the deep branch. Fine. And always don't try to just keep on drawing on your books over there. Try to even practically apply. That means the ulnar nerve is entering here and it is dividing into superficial and deep branch is taking a turn and going on the other side. It's actually taking a turn and going on the other side. Now, out of these two, remember, the superficial branch is the one which will be supplying to palmaris brevis muscle. Palmaris brevis muscle. So, I hope you remember all the hypothenar muscles. And out of that, one of the muscle will be just subcutaneous, just below the skin here. If you just reflect the skin, even that muscle will also be gone. So, just below the skin here, superficially, you'll be having palmaris brevis muscle, and that will be actually supplied by superficial branch of ulnar nerve, guys. And not only that, remember, it is also, the superficial branch is also supplying to the skin of medial 1.5 hand. I'll tell you the reason why I'm using the word here as complete hand here. Ulnar nerve will be supplying to the skin covering the medial 1.5 complete hand here, guys. I mean to say even on the palmar surface as well as the dorsal surface. Understanding? On the palmar surface, medial 1.5 digit, the little finger and half of the ring finger, and even the dorsum of the hand also, guys. So, we'll just try to make a small picture of this one here. For example, if this one will be your little finger, ring finger, the middle finger and the index finger, and this will be the thumb here, guys. And imagine this one to be your palmar surface. Fine. Now, in this, only that medial 1.5, the skin covering, the medial 1.5 digits. And as I said you, not only the palmar surface, even the same is also on the dorsum of the hand, guys. That is the reason why I'm just mentioning the word there as complete, medial 1.5 hand there, the skin of medial 1.5 hand on the palmar as well as dorsal aspect. Now, once this is done here, what about the deep branch? Now, deep branch, you don't have to worry about that one. Everything else, you can just dump it over there. It is taking care of everything else. So, what is this deep branch supplying to, guys? Number one, it will be supplying to all your hypothenar muscles, all the remaining hypothenar muscles. Fine. Why? Because palmaris brevis is the one which is taken care by superficial branch. So, remaining all flexor digiti minimi, abductor digiti minimi, opponens digiti minimi, everything will be taken care by the deep branch. And then after hypothenar, I told you that the deep branch will also be supplying to the lumbricals, and that is lumbrical number 3 and the lumbrical number 4. So, the medial two lumbricals, lumbrical number 3 and 4. And then it will be supplying to all the interossei, all interossei. The 4 palmar as well as the 4 dorsal interossei are supplied by ulnar nerve only. And finally, I told you after supplying to all of them, it will be going and ending in a muscle that will be the adductor pollicis muscle. That's the graveyard of ulnar nerve. So, adductor pollicis muscle, guys. It's ending there. So, that's the entire story regarding the ulnar nerve made easy in a simple diagram. Okay. So, you can just mention here, this will be actually in the arm. Okay. And this part will be actually the forearm. And finally, this will be in the hand, guys. Fine. And one more thing, you have to make a note here. Remember, ulnar nerve is actually going to pass superficial to flexor retinaculum. I'm just writing in short here, flexor retinaculum, guys. Ulnar nerve is passing superficial to flexor retinaculum. Wow. And I believe that picture-based memory, like image-based memory, will be for long term. So, if you just practice this, you can never ever get confused in the ulnar nerve. Any question that might ask you guys. Now after completing the entire normal thing regarding the ulnar nerve, now let us see like what will be the injuries of ulnar nerve here. If it is injured, then what will happen, like how to differentiate. We can actually divide the ulnar nerve injury into two categories, guys, like the higher lesion and the lower lesion. Fine. So, first of all, I'll tell you here in detail, and after that we'll make a note of this one. And I want you all to be like more alert now. Why? Because this is the most important part nowadays. The trending thing, the clinical concepts are very much important nowadays. So, injuries are being tested very much in the exams. So, concentrate here, guys. Ulnar nerve injuries we can divide into two categories. One is higher lesion, another one is the lower lesion. Either it can be injured near the elbow, as I told you here, cubital tunnel syndrome. The ulnar nerve can be trapped between the two heads of flexor carpi ulnaris, or the ulnar nerve can be injured here, fine, near the wrist. And it can be like Guyon's canal syndrome. I hope you know about the Guyon's canal here, which is like medial to pisohamate ligament. So, it can be Guyon's canal syndrome, or they can be laceration, wrist injuries and all. So, therefore, the ulnar nerve injuries can be divided into higher lesion and the lower lesion. But whenever you are learning about nerve injuries, first of all, try to find out like what is the main important feature of ulnar nerve injury. If ulnar nerve is gone, whether here or here, I mean to say like higher lesion of the ulnar nerve or the lower lesion of the ulnar nerve, anywhere, remember all these 15 muscles present in the hand will be gone. Now, if these 15 muscles in the hand are gone, then what will happen? The hand will be actually converting into like this here. What is this? This is claw hand. But is it like complete claw hand? No, it is just a partial claw hand. Partial claw hand, or else we can also call it as ulnar claw hand, guys. Okay. So, you have to make sure that whenever ulnar nerve injury will be present, the patient will always come to me with a partial claw hand, or vice versa. If any patient comes to you with a partial claw hand, definitely it is which nerve involved? Ulnar nerve involved. Now, what is the next challenge in front of you? Once the patient comes to you with a partial claw hand, yes sir, it is ulnar nerve. Now, the next challenge is whether it is injured here, that is a lower lesion, or the higher lesion. How to differentiate that? I'll tell you. Listen here, guys. If there is a lower lesion of the ulnar nerve, if it is injured here near the wrist, then there will be partial claw hand. But remember here that these muscles are still working. Why? Because if the injury is here, all the muscles distal to that will be gone. Proximal to that, before that, the muscles are still working. Okay, so these muscles are actually spared. They are still working. Okay, they're not involved in the injury here. So, which muscle I'm speaking about? I'm mainly concerned about FDP, flexor digitorum. So, flexor digitorum, you concentrate on that one. It's still working. So therefore, if the ulnar nerve is injured here, there will be clawing, but remember the clawing will be more. Why? Because FDP, flexor digitorum profundus is still working, and therefore it will flex and the clawing will be more concentrated at this point here. Okay. Now suppose if the ulnar nerve is injured here, hyalation. Hyalation, what is happening here? If this is injured here, FCU is gone, FDP is also gone, and as well as all these 15 muscles are also gone. And because these 15 muscles are gone here, again there will be clawing, but this time the clawing will be less. Why? Why? Because even FDP is also gone. So therefore, if the FDP is gone here, yes, the flexion will be less and the clawing will be less. Now try to understand, guys. When there is a higher lesion, the clawing is less. And when there is a lower lesion, the clawing is more. So it is kind of paradox. And this is actually said to be the ulnar paradox. Crystal clear concept, guys. So high lesion, there will be less severe clawing, and low lesion, there will be more severe clawing, guys. Okay, that is known as the ulnar paradox. I hope the concept is crystal clear. Let's make a note of this one. So in this applied aspect, ulnar paradox. Now, what is this ulnar paradox, guys? Write it in a simple manner. High lesion and the low lesion of ulnar nerve. And whenever there will be like higher lesion of the ulnar nerve, what is going to happen, sir? There will be less claw. And why there is less claw here? Why? Because FDP, flexor digitorum profundus, is involved here. Fine. And whenever there is a low lesion of the ulnar nerve, then there will be more claw. More claw. Why? What is the reason for this one, guys? The reason is very simple. FDP is spared. It's still working. Fine. And this gives a kind of opposite. There is nothing but your ulnar paradox here. Hope it is very clear, guys. And one more thing that you can include here, what can be the reason? What can be the reason for this high lesion and the low lesion? One common thing that you have to remember for high lesion is cubital tunnel syndrome. Be very careful, guys. I'm telling you again and again, it's not carpal, it is cubital tunnel syndrome. Fine. And what is the reason for the lower lesion? Lower lesion, one of the reason can be Guyon's canal syndrome. Guyon's canal syndrome. Fine. So I'm just making you write down the most like important ones that you have to at least remember. I'm not writing the list of all the reasons for the lower lesion and high lesion. At least you have to know about this one, guys. So that is entire thing regarding the ulnar nerve, the root value, the origin, the motor supply as well as sensory supply, and then a beautiful schematic diagram so as to remember that one, and then finally the applied aspect. If there is injuries, how to differentiate between the high lesion and the low lesion, guys. That's all done.